9:30 here in New York, a top virologist in China defending her research in the lab in the city of Wuhan where COVID first emerged. The thinking that the virus leaked from that lab is getting more and more attention, and now the former CDC Director Robert Redfield sitting down for an exclusive interview with Fox. Dr. Marc Siegel spent 2 hours with him over the weekend. Doctor, good morning to you. What did you learn?
Bill, a year and a half ago, Dr. Robert Redfield, then CDC director, had a hypothesis about the emerging virus. So did Dr. Anthony Fauci. Redfield felt that the evidence pointed to a lab manipulation and a leak, and Fauci didn't.
There's an alternative hypothesis that it went from a bat virus, got into a laboratory, where in the laboratory it was taught, educated, it evolved, so that it became a virus that could efficiently transmit human to human. My professional opinion as a virologist is that's the hypothesis that I support. You know, other individuals, Tony Fauci, for example, would say that he prefers to support that it evolved from nature. I think those are the two hypotheses.
Dr. Fauci has long believed the virus came from an animal intermediary, a theory that gained the most traction in the media, and only recently he has conceded that there might be another explanation.
I think Tony is holding on to this hypothesis tightly. Now, why would that be? Sometimes scientists, when they get on, they bite into a bone on a hypothesis, it's hard for them to move on. I guess if I'm disappointed about anything about the early scientific community, is that there seemed to be lack of openness to pursue both hypotheses.
Dr. Redfield told me he had a higher level security clearance than others on the task force, working directly with the State Department and the National Security Council, giving him early knowledge of the virus's characteristics that others on the task force just didn't have. But much of what he reviewed was classified. He says data like this needs to be shared wider to protect Americans.
I think the first critical error was we called this SARS-like. COVID-2 is not SARS-like. And by calling it SARS-like, we mounted a public health response that was mirrored off SARS. The problem is COVID's nothing like SARS. This virus's transmission is largely asymptomatic. So that strategy that we started in January and February and finally figured out as we got into March that that wasn't the situation here, that probably most of the transmission of COVID was from asymptomatic people, was flawed.
Dr. Redfield claims it was a big mistake his CDC team wasn't allowed into the Wuhan lab when the virus was first identified in January 2020. He says he should have pushed harder to get in right away, and the World Health Organization was too compromised to help.
I think they were highly compromised. Clearly, they were incapable of compelling China to adhere to the treaty agreements that they have on global health, because they didn't do that. Clearly, they allowed China to define the group of scientists that could come and investigate. That's not consistent with their role.
Dr. Redfield told me he is concerned that manipulating viruses may be research that we are not quite prepared to be doing, and he warned against what he called going down a path of scientific arrogance. Bill, Dana?
Doctor, if you could just put a fine point on this for us. I just want to be very clear about this. Redfield's running the CDC, right? I mean, they had their eyes on this thing probably in December, for sure in January and February. When did he start thinking about the virology lab in Wuhan?
Great question, Bill. He started thinking about it at the very beginning, December and January, And then he started accumulating evidence through State Department and the National Security Council that verified this suspicion he had. But he told me that the task force was not focused on that. They were focused on what was going on here in the United States. So his voice was drowned out, Bill.
I think one of the things that I learned from there, just to really focus in on, was when Dr. Redfield said that because we didn't know about the origins, we in America, we're treating this as if it were a SARS-like virus, which we had dealt with before, but that was the exact wrong thing to do. If we had known that it was this other issue, the coronavirus issue, we would have treated things very differently. And we're about to come up on the 600,000th American to have died. And
Dana,
you think back to that, and that seems to me like that's why you need to know how these things get started. That's why China should have cooperated in the first place.
Dana, that is so true. The structure of the virus, according to Dr. Redfield, led to that massive asymptomatic spread that caused the virus to rifle through our communities. And how contagious it was specifically due to that. And that's something that the origins play an exact role in. You're absolutely right.
This is a really another fine point here as we look back on this, Doc. Asymptomatic spread. I don't believe that we really understood that until mid-March.
Right.
Because here in New York, we were living our lives, and Madison Square Garden had, I think, 10 different events over a span of 7 to 9 days. And the Wall Street Journal did a great analysis of the hundreds of thousands of people that would cycle through Madison Square Garden for a hockey game or an NBA game or a college basketball game. And the possibility remains that a lot of these people could have been exposed to it, and that they go out in the community, and over the next 10 to 14 days, they're spreading this. Is that how we now understand sort of the mistake or the fault in not understanding COVID in the very beginning like that?
Completely right, Bill. Very well described. Listen, Redfield knew before almost anyone else he had the high-level clearance, and he told me he wishes he had done a Manhattan Project of testing, not just a vaccine, once he knew that the asymptomatic spread was so prominent.
Okay, one last thing. The lab leak theory, he subscribes to it based on the World Health Organization's report 3 months ago in March. Does he think the leak was accidental or done with intent?
From everything I gleaned from that 2 hours, he does not believe the leak was on purpose, that it was accidental. But what was not accidental was perhaps what was going on in the lab in the first place to tweak the virus.
Mm-hmm.
Wow. A lot of revelations there, Doctor. Good work.
Excellent work. Thank you so much.
Thank you, guys.
Thank you.